Ever find yourself compulsively cracking your joints? Well, that tiny popping sound comes from synovial fluid, yes, that slippery lubricant in your joints, sometimes releasing extracellular vesicles that carry all sorts of signals. But if joint issues persist, it could be a sign of arthritis, a fancy word for joint inflammation, which can be quite the party pooper for your mobility. Meanwhile, deep inside your brain, the hippocampal region is busy managing memory, but it can also be affected by synaptic dysfunctions, those tiny miscommunications between neurons. This can lead to changes in neuronal function, which scientists often study through electrophysiologic methods. And just like in your joints, inflammation can have a role here too, with peripheral inflammatory mediators making their way into the central nervous system, stirring up trouble. In the brain, support cells like astrocytes and microglia are the unsung heroes and sometimes troublemakers reacting to injury or disease. When they get activated, they become reactive astrocytes with hypertrophied cell bodies, producing glial fibrillary acidic protein, or GFAP, as a marker of their activation. These cells release cytokines, chemokines, and complement proteins. Think of them as the body's emergency signals calling for backup to fight off inflammation or injury. Speaking of inflammation, cytokines are tiny messengers that can cause an array of responses, from recruiting macrophages to ramping up the immune response. Sometimes inflammation gets so intense it leads to the formation of amyloid plaques and senile plaques, hallmark features in neurodegenerative diseases. These plaques, along with acute phase proteins produced during inflammation, can cause morphological and molecular changes, leading to functional alterations in brain tissue. Now, inflammation isn't just limited to the brain. It can involve complex processes like coagulation, fibrinolytic factors, and integrins, all part of the body's intricate response to injury or infection. And in some extreme cases, such as arterial gas embolism, bubbles of alveolar or venous gas can travel through the bloodstream, causing blockages. Interestingly, hyperbaric oxygen therapy is sometimes employed to treat these bubbles, helping to dissolve them and restore normal blood flow. All of these processes, whether in joints or neurons, highlight how our bodies respond to injury and inflammation. From the tiny bubbles that can cause embolisms to the microscopic signals that drive neuroinflammation, it's a fascinating, if sometimes chaotic, dance of biology. So next time you crack your joints, remember, even that tiny pop is a small window into the complex world of human physiology.